So today I'm going to speak to you about the infographic we've produced about self-harm in older adults. Now this is a collaboration between 3 different projects, so Ali at NKish, myself at Manchester Self-Harm Project and Leah at the PSTRC. So I'll just spend a couple of minutes talking about why we started to do infographics in our department and some more of the specifics on this particular infographic. Okay, so as academic researchers, a lot of our research outputs are reports and journal papers. So journal papers are really important because they're scientifically rigorous, they're peer-reviewed, so they're held up to a lot of scrutiny. However, papers can be a bit time-consuming to read. You know, busy clinicians and other people don't have time to read them. They're not the easiest to understand as well. And sometimes it's hard to get hold of these papers if you're outside academia itself. So a few years ago, in our department, we started producing infographic sheets so we get our key messages out in a much better, clearer way and reach a much more varied audience. Okay. So, with this particular infographic on self-harm in older adults, we combined data from 3 different data sources so that we could get a more complete picture. We also asked a member of our PPIE departmental group to give us some feedback at the design stage of the infographic, so we can make some tweaks and make it as good as we could make it. Okay, so this is the front page and back page from the infographic. If we delve a bit more into this back page first, you remember me saying that we used information from 3 different data sources. So number 1 here, this is data from the multi-centre study of self-harm. So this is A&E unit data from Manchester, Oxford and Derby. People who presented after having self-harmed. The second data, this is the Kathy Morgan paper, which was mentioned earlier, and this was using National Primary Care data set. And our third data source, this was a NKish report from 2019. Okay, so moving to the front page of the infographic, this is the top bit. Now what I've done with the PDF of this infographic is I've embedded a lot of links to websites, so it's easy for you to see with other work as well. So embedded in here, we've got the link to the website for NKish, also the PSTRC, and in here, if you right click on that and open it, you can get to the Manchester Self-Harm website. I've also embedded hyperlinks into the text here and here to the original data sources. So if you do want to go and find the original papers, the original reports that data came from, you can do that. So this little one here, that signifies that it's the data sample 1, and 2 over this side is the second data sample. Similarly, this has the 2 and the 1, and these are linked to the original data sources. And here, this is all from data source 3. So this is all from NKish's 2019 report. And the bottom here, I've mentioned the funders. You can click or scan the QR code to have a better look at our data sources. And also I've embedded links to each of our Twitter pages, so you can find out what we're up to currently. Okay, now I'm going to attempt to show you where you can find on the internet our old age infographic. So this is our Poor MASH website, and then the top left here, some of you will know about this page already. This is the community care-based care for self-harm. So hopefully if I click into that, okay, so some of you might be familiar with this. We've got lots of great resources in there if you want to have another look at this later on. But what I'm going to do is I'm going to scroll down to section 4, where we've got information on research on self-harm, and specifically by age group. So we've done other work as well on children and young people. We've done work on people in midlife, and down here we've got people, the old age infographics, and again we've got a link to the campaign that Ali's just been talking about. all that remains now is for me to skip to the end and say thank you very much for listening. Here's some more information on our resources.